After like 1 to 2 sessions of this, and once you've started gaining your patient's understanding and trust, then by the third and fourth sessions, you can progress to non-thrust mobilization technique. Position the patient and yourself the same and take her trunk to mid-range rotation by taking up the slack as tolerated for grade 2 mobilization. From there, you ask the patient to breathe, and during the exhalation phase, you rotate further as tolerated to get to grade 3 mobilization or up to the limit of the range. You can hold this particular position for 30 seconds. After that, ask the patient to breathe one more time, and during that exhalation phase, take her trunk to grade 4 mobilization range